So the MOE is what is preventing us from moving forward with some of the things that we need, the flexibility in the state of Illinois to make some of the changes that we're going to have to make in Illinois on our Medicaid system in order to bring down the bills. So some of the major parts of the reform bill that we did last year are being prevented by federal CMS because of that, which are the income verification, the citizenship, and the passive redetermination.
And can you talk a little bit about the growth in Medicare or Medicaid spending, but also in Medicaid population?
Absolutely. The Medicaid population, when I started getting active in this, was 1.6 million about 4 or 5 years ago. It's now at 2.6 million and costing the state of Illinois $15 billion. When the ACA Act goes actually through in another year and a half, we will be adding on another million people onto the Medicaid system at the cost of another $1.6 billion. So then you're bringing it up to $16.5 billion. Now, that population is supposed to be paid for by the Federal Health Care Act, but we're leery of that, whether that's really going to be, all the people that are in there are going to be taken care of. So right now we definitely have $15 billion worth of bills and $2.5 billion as of this June that will have to be paid, $5.4 billion by the next year.
And how is the state going to be able to stop spending so much on Medicaid? Like, what changes are we able to make?
Well, you know what? We have introduced 2 bills over the last 2 years, and we had probably 18 issues in there that we could save, we felt, close to $2 or $3 billion if they were all enacted. One of them being the recapture audit, which the president has been a patriarch of in certain pilots throughout the United States, and we implemented that. I mean, we passed it. It hasn't been implemented. So that, we felt that bill alone could save us $1 billion. We have the eligibility issues, and we have the optional services, and everything must be on the table this year. When you have an entitlement program and you have such fragile populations that need these services, you have to be very careful as to how you approach this. We do not want to take the population that absolutely needs this health insurance off of that, but we have to address some of the other issues of maybe people that are receiving services that don't meet the eligibility. And I would say the number one issue that needs to be addressed this year is eligibility.
And then just kind of, we were looking up statistics, and was it like 1 or half the babies born this year were born through Medicaid, or do you know any of the statistics?
Absolutely, because I address these issues all the time. You have 50% of all babies in Illinois are now delivered on Medicaid. You have 1 out of every 3 people in a nursing home is on Medicaid. You have 1 out of every 5 Illinoisans is on Medicaid. And what really is staggering is 1 out of every 3 children in Illinois is on Medicaid. 1 out of every 3 children is on Medicaid, but 1 out of every 2 births is on Medicaid. So you have 2.6 million people in Illinois, which used to be the 6th wealthiest state in the United States. Now it's around 12th or 14th, and that population has grown astronomically.
And I would say that wraps up my questions. Is there anything else that you want to add on this topic?
Well, the problem is this year, when you're addressing the budget of the state of Illinois, there's only 2 major issues that really are going to make a difference where we can work on saving money, and they're going to be Medicaid and pensions. And so Medicaid, it's going to be a very, very tough choice, but it's unsustainable right now. And the projections that came out today are even more unsustainable. So we have to address the issue as some of the ones. We put a resolution out last year. We tried to send it to the federal government. It did not pass, and those were to get flexibility from the federal government to work with us on a waiver on some of these issues so that we can address some revenue cuts in the population. One of the main things that we may move forward on is to redesign the entire Medicaid system in Illinois, which is what they are doing in several other states right now. That would have to be over a couple of year projection.